The bill, which will now head to the Senate, includes a provision to defund Planned Parenthood. Under the American Health Care Act, Planned Parenthood would be cut off from federal funds for 1 year. Dawn Laguens is the Executive Vice President for Planned Parenthood. She's with us now from Washington. Dawn, I just mentioned it briefly, but give us some sense where the bill stands right now. What does this mean for Planned Parenthood?
Well, I have to just say how stunned I was to see pictures of our elected officials basically gathered together yesterday, having a kegger at the White House and patting themselves on the back for one of the worst bills and pieces of legislation in a generation when it comes to women's health. Of course, there is the denying millions of women the ability to come to Planned Parenthood for preventive health care like birth control and cancer screenings. There's also cuts to maternity care. There's making having been raped or a victim of domestic violence a pre-existing condition. It's really a terrible bill, and I hope the status is that it's dead on arrival in the Senate.
The cuts that you mentioned, do those fall under pre-existing conditions, or is it under Medicaid, or is it both?
Well, the way that Planned Parenthood, of course, sees patients is just like a hospital or any other doctor. We're not a line item in the budget. We get reimbursed when a woman or a man comes to us for, again, preventive health care like birth control, cancer screenings, STD testing and treatment, HIV testing. So it's really just denying women, millions of women across this country, the opportunity to see the provider of their choice, which is supposedly one of the key things that these politicians have said they're trying to protect, which they obviously are not.
So the idea that they could maybe seek medical treatment somewhere else from other providers, this is the idea that you want them to be able to reach out to the providers of their choice.
Absolutely. I don't know why women, and poor women in particular in this country, should be discriminated against in choosing who they would like to see. But the other important point is every serious medical organization in this country has said there aren't other providers. In 50% of our health centers are located in rural or medically underserved communities. So there's not somewhere else to go. In Paul Ryan's district in Racine, Wisconsin, there are no other safety net providers than the family planning of Planned Parenthood.
One of the biggest concerns for conservatives, they say, was the fact that taxpayer dollars, according to them, were being used to fund abortion. Let's listen to Vice President Mike Pence at a recent anti-abortion rights group, and then I will get your take.
The bill before the Congress actually eliminates Obamacare's abortion expansion, and it defunds Planned Parenthood and keeps the president's promise to devote those resources to health care providers that help women without promoting abortion.
Planned Parenthood already banned from using federal funds for abortions, but I will allow you to respond.
Yes, thank you for that. Of course, we don't use federal funds for abortion. I may disagree with that, but that is the law, and that is the law that we follow. Also, we are at the lowest point in basically a generation, 40 years, for unintended pregnancy and teen pregnancy in this country. And all this bill does is mean that we will start to have more unintended pregnancy, and people's lives will be disrupted, their education, their economic opportunity. So the vice president actually just isn't telling the truth.
Dawn, we know right now this bill is going to the Senate. We've heard for the last 24 hours how it's not going to look the same after the Senate is done from it, if not maybe even just starting over from scratch. So what does Planned Parenthood want to see happen in the Senate?
Well, I would certainly like to see this be a bipartisan effort that actually did not make being a woman a pre-existing condition again, did not drive up the cost of being pregnant by, one estimate, 400%, does not limit the choice of women about where they can make these important decisions for them and their families. And I would like to see, obviously, it be rigorous in terms of actually being based in science and not the ideology of the vice president.
How optimistic are you that you're going to see the changes that you want in the Senate?
Well, I'm optimistic that because 80% of Americans are very clear on the role that Planned Parenthood plays, and we saw that something like 83% of Americans objected to even the last version of this bill, which wasn't as bad as this version, that they're going to speak out and be heard from by these senators, and that we, in fact, are going to see a lot of changes. And we're certainly going to be out there advocating for them.
Dawn Laguens of Planned Parenthood. Dawn, thank you.
Thank you.